Unpacking Mormonism is a subsidiary of Daisy Girl Communications, LLC. All content herein is intended for educational purposes only and does not replace the advice or counsel of your personal care provider. Hello, and welcome back to Unpacking Mormonism and Other Religious Trauma. Oh my goodness, I almost said, and growing up to show up from my Raising Crazy podcast. So, hey, plug in.
That would have been a foible.
Right. Plug in. It would be great to see you all on Raising Crazy, Growing Up to Show Up, which is a podcast about parenting.
Indeed.
Indeed. Yes. Okay. All right. So, Mason, what do you want to talk about today?
You're gonna make it sound like I get a choice in this? Cool.
Uh-huh.
So, I'm going to introduce this topic. Since we've already decided what we're going to talk about, of course, we listen to Mormon Stories number 1660.
Mm-hmm.
And it was John DeLynn, John Larson, and Kara all kind of getting vulnerable, just talking about the pain that has come from their journeys and recognizing that pain comes on both sides of the journey. There's pain for those that leave the church. There's pain for those that have people leave the church. And
right, so pain for those who leave, pain for those who stay, pain for those who are anywhere in between.
Pain all around. You get some pain. You get some pain. Everybody gets pain.
That sounds terrible and morbid, but it's true. I absolutely loved how vulnerable they were. I'm going to say it was probably my second favorite episode of John Larson ever. My favorite is the transoceanic vessel from when he was hosting Mormon Expressions, I think is what it was called. But yeah, I agree, Mason. I absolutely loved that episode. I loved the vulnerability. I loved the discussion. And obviously that makes sense. I love it when people talk about emotions because that's my thing. That's my jam.
Sure.
And they did it very well.
They did. And you know, some of it's hard again. Like if there's been any emotion at all involved in the process of either choosing to stay in the church or choosing to leave the church, of any church, if there's been any emotional attachment to it, which I can't see how there isn't, but I imagine for some people there is, if there is any emotional attachment, there's going to be pain, and they really help to kind of address that really well. And
normalize it.
Yeah, and we're not coming, of course, that's the introduction. We're not coming to talk about that episode. They do a wonderful job of kind of going through the material that they wanted to do, and we don't want to take away from that. We want you to get that from the source. So if it's something that you're interested in, it was a terrific episode.
Well, and we will link that episode to the show notes.
Yeah.
For sure, because I mean, that was one of those that I would say it's golden, y'all. Go listen to it. Support Mormon Stories. They do excellent work over there. And that one really stood out to me and touched me differently than I've been touched in a long time. Oh, that sounds almost creepy. Touched me. Not that kind of touch. So anyway, yeah, I think our intention today.
So there's a piece of it.
Oh, yeah,
I hadn't got to that. There's a piece of it where they start talking about life coaching versus counseling. And you know, there's a little bit of just there's a lot of opinion about that. John DeLynn, of course, has a doctorate in counseling and psychology, so certainly has some background on what those things are. But they all kind of share their opinions about those things, and you wanted to be able to get on here and kind of address those a little bit deeper, because they didn't go very deep into that topic because that wasn't really why they were there.
Right, that wasn't the purpose of their podcast,
right.
But they raised a
question that you thought would be very helpful, that I imagine lots of people have had. And so the purpose today is to kind of delve into that a little bit and recognize which one might be the most helpful for you and why.
I don't know if we've said which one is like, what are we even talking about? So
life coaching versus counseling.
Okay.
Right. So
I don't remember if we had said that
depending
already.
on each, we have listeners, depending on your situation, which one might be of the most value, and how so would they be of value to you?
I think that both Johns brought up, I don't think Kara chimed in too much on that, but I do know that both Johns did. And it's a very relevant question. And like you said, Mason, a lot of our listeners and a lot of people out there kind of wonder the same thing, which is better, a life coach or a counselor. And I actually, one of the things that made me go, hey, we really need to podcast on this as a professional licensed counselor. I am a licensed professional counselor. So I'm a master's level counselor. What is best? And as a LPC and a life coach, because I do both, I think that I can really answer that question. And one of the things that really drove home the point that this really need to be talked about is that I was having a conversation with your sister the other day, and she told me, oh yeah, I hate counselors. And I was like, ooh, ouch. Yes. Oops. But she said the reason was that she just felt life coaching was a better fit for her. And I want to kind of bring that back as to why that might be, not as a way of judging your sister, not at all, but as that, hey, this is probably what's going on, because she's not alone in feeling that way. And so I want to...
And hopefully that would translate to everyone, right? When you talk about, well, where is my sister in her life that makes her feel like life coaching is more beneficial to her, other people are going to be in that same situation, might not understand. My sister might not understand what it is about life coaching that really fits her better. And if she does understand that, that might help her to get into a better place even for herself.
Right. Well, and I think it's important. I have no idea where your sister is at. The only fact I have is that she expressed
Arizona.
to me, yes, she is in Arizona, but from an emotional place,
Sorry,
I don't know
terrible.
where your sister is at, because that's not something she shared with me. The only thing I know is that she stated that she felt life coaching fit her better, her style of learning or whatever it is. And that's great. But I really want to be able to dig in to this topic. Do you need a life coach or do you need a counselor, so that you, the listener, can be informed? So my intention today is to recognize that both can be incredibly helpful. And how do you, the listener, know what type of professional you need to seek based on the things you know about yourself? Mm-hmm. Having said that, I think it's important to remind the listener that research demonstrates that 80% of the efficacy of counseling, and I'm going to say by extension, life coaching, is in the relationship between the client and coach or client and counselor. That's what the statistics say. And those statistics have been the same for decades. As far as I know, it was taught for decades before I went to school. It was taught the entire time I was in school. And the last time I looked it up, it always lands right around 80%. I've seen some that are like 79 and some that are like 82%. So I'm just going to stick with 80% of the efficacy of your treatment is the relationship. So that means shop around, because if you have a life coach or a counselor and you don't feel comfortable or heard or understood, it's not the right fit and has high potential to cause harm. And I think a lot of people will go into a counselor and expect it to be a good fit, and then they feel, hurt or unheard or something, and it just turns them away from counseling altogether. I'm going to say that I kind of feel like this statistic is probably similar for a lot of doctor-patient relationships as well. You could be the best neurosurgeon on the planet, but if you're an asshole in clinic, me, the patient, I'm going to have a hard time trusting you. The difference is that it's a lot easier in medicine to track your results. Like if you're a neurosurgeon and the majority of your patients after you perform surgery heal and get better and have an improved quality of life, it's a lot easier to put up with shitty bedside manner. That's normal because we have those numbers. But in counseling, we don't have those kind of numbers like I do for my own clinic, because I send out evaluations and ask my clients, I do that randomly. I pick clients randomly, and I use a little thing on my computer that generates those so that they're, as random as I can possibly get them. And I will send out surveys at the 3-month mark, the 6-month mark, the 12-month mark, the 18-month mark. But I do that to inform myself as to whether or not I'm meeting the client's needs. I don't advertise those results out loud because I don't know, it kind of feels a little narcissistic. Look at my success rates. But really that comes to my own quality of care that I'm conducting on myself and within my own private practice. It's not just me. I have sent those surveys out for other clinicians that have worked for me in the past as well. And that really helps me. If I get a lot of feedback about something going wrong, I can sit down with that clinician and kind of dig in and examine, what's going on. Is there something here that you could improve upon? But I do that for myself because I want to be the best provider that I can.
I would imagine that the relationship is similar when it comes to medical practitioners. I'd be surprised if the statistics are the same, simply because of the nature of what's going on in a doctor's office. If I come into a doctor and say, hey, I'm struggling with acid reflux, then they're going to follow certain algorithms.
Right, there's a lot of protocols. You do this, then this, then this.
Okay,
then this.
You have acid reflux. Well, let's try you on a PPI first, and then go from there.
Right.
And then you decide whether or not you're going to follow up or whether or not that treatment is working or whatever. So I think the statistics are probably a lot different, and it's just the nature of the way that works.
That's true.
And so for you, I was going to ask, I think I understand, but what is it about a counseling relationship that leads us to that 80-20? So 80% of the success of your treatment is based off of what?
If my client cannot feel comfortable in our sessions, if they do not feel emotionally safe, their brain will not relax enough or be in the right state of mind to learn new things or to talk about triggering events and difficult things. If they don't feel safe with me, it's not going to work. And I tell my clients in my informed consent from the get-go, I let them know, if you don't like me, if there's a personality conflict or you don't feel safe with me, let me know, and I will give you a list of referrals of other clinicians in the area that have, they do things differently than me. They have different personalities than me, but I've seen their treatment outcomes as being positive, and I want to make sure that if for whatever reason you don't have that with me, I want to hand you a list of people that I would send my own family to that you might have a better fit with. Because usually when it's that 80%, for me anyway, it's been kind of a personality conflict. It's like, oh, we just don't really click. And I've had it where I've called it out and said, hey, just checking in. Sometimes this feels a little awkward for me. Are you feeling that? And most of the time my clients are like, yeah, this is really awkward. And I've kind of been questioning as to whether or not I want to continue with you. And I'm like, hey, if it's awkward for you, that's a pretty good sign. I want you to trust that. Now, I would say give your clinician 2 to 3 sessions, unless it's just so grossly not a good fit, then don't. But, it takes a little while sometimes to get to know somebody, especially if you've got a lot of difficult things going on.
Sure.
But, I'll be honest, as a clinician, I interrupt my clients a lot. And I do that as a way to stay focused and engaged on the topic. But for some people, that can be so off-putting that it would interfere that relationship. And so for some clients, I know I listen better. But for others, when I feel like it stalls out that treatment, we're gonna get them to somebody who practices with a different technique than me that is gonna fit their personality better. Because number one important thing in my clinic is that the client feels emotionally, physically, spiritually, and mentally safe. Because if they don't, their amygdala will not allow them to do the work that needs to be done. And I'm going to say that by extension, that is true for life coaches as well as counselors, which I absolutely loved that John Larson in that episode, the Mormon Stories episode 1660, that he said, shop around.
Yeah.
That is amazing advice. He also said, like, only 1 in 10 counselors worth their shit. And unfortunately, I agree with him.
Well, I'm sure that depends on what kind of stuff you're trying to unpack.
Right.
You know, where you are. But so what I've always said is, and I don't have a lot of experience with this, but so, you know, the numbers are just kind of vague, but I feel like 10 to 20% of counselors are terrific. 10 to 20% are lousy, and the rest just fall somewhere in the middle, and it just depends on your relationship with them. I would never... Again, one of the reasons you love John Larson, right, is just directness. He's like, he just tells it like
raw.
He feels it.
Yeah, he's just so raw.
Doesn't make him right.
Yes,
and in this case,
it.
I think he's wrong. Like, I wouldn't say that 10% are worth their salt and the rest suck. I wouldn't say that about almost any profession. But for him, that might actually be true because of where he falls and how he works a relationship with a counselor. He's going to end up with a lot of counselors who cannot meet his needs. Mm-hmm. And everybody's going to end up with situations like that. And I think that's why this kind of education is helpful. What is it you're going to get from a life coach? What is it you're going to get? What can you expect from a counselor? Because if you walk in with realistic expectations of what to get from a counselor and you see that you're not getting that, that lets you know, time to move on. Let's find somebody who can do what it is that I need. Because some people will want you to just listen and let them vent, right? Some people are going to know, if I'm going to get through this, I need to expect to be uncomfortable.
Right.
But I need to feel safe. And knowing that you can form the relationship necessary to accomplish what you came for.
Well, and on that line of thinking, being uncomfortable in a counselor's or life coach's office is normal and appropriate.
Right.
I want you to feel safe with that discomfort. I tell my clients again from the get-go, if I don't frustrate you and push some buttons on occasion, I'm not doing my job.
Right.
But I want them to feel safe. Like, I want them to be able to know, okay, I can be frustrated and I can even say, Sarah, no, I think that's shit. I want them to be able to say that to me. And then for us to explore, well, what's going on for you? What's going on here? Did I make a mistake? Or am I pushing some of these triggers? I mean, I've got one client that will look at me and just be like, I need to digest this one. Wait, Sarah, you got me. Like, I want to scream at you, but I need a minute. And I've been seeing that client for over 5 years, and that client has made amazing progress. But yeah, I will push my client. So if you're not the type of person that learns by being pushed a little bit, I'm not going to be a good fit. So absolutely, I want to say shop around. Okay. So let's dig in, Mason.
Let's do. I got my shovel.
You've got your shovel? That's great. All right. Life coaches. So the number one thing with life coaches is anybody can be a life coach. All they have to do is say, I'm a life coach, and charge you money, and bam, you got a life coach. So one of the things that
that's a significant difference.
Just a bit. One of the things that both Johns brought up in episode 1660 was that life coaching is very unregulated. I would also say that a lot of life coaches go through very minimal training in order to then take on that title of life coach. And so you're going to want to screen a life coach, you're going to want to make sure that the goals that you're working on are stated right up front. And then you need to kind of keep track, as this person encouraging me to meet my goals, what's going on here. You're going to want to be critical of that. And I will say, be critical of your counselor too. Absolutely.
Sure. Yeah. It seems very goal and maybe even superficial goal oriented. I think you mentioned things like life coaching is popular in, what did you write down? Like diet, fitness, exercise, those kind of things.
Mm-hmm. Learning how to organize your closet or time management. I like to say it's more like a life skills thing. It's more of a how-to thing. Life coaching, generally what happens with life coaching is you come to the life coach saying, I struggle with this thing.
Right. I want to lose 10 pounds.
Right.
Or help me get there.
I want to learn how to communicate better, or I want to be more effective in my sales, in my business, those types of things. So generally with life coaching, the client comes to the coach with a very specific goal in mind.
Right. And that's not to disparage at all what they do, because these are important things too.
No, so
just recognizing they're not the same as something else.
Right. So I'm super busy, and I use the app Noom, like the diet and fitness app Noom. And I would say that Noom is really beneficial in the sense that it's more of a digital life coaching app to help me meet my healthy nutrition, healthy exercise, calorie and weight loss goals. And in that program, they use cognitive behavioral therapy techniques, but it's a psychoeducation platform. They are doing that to educate the population and help you meet your goals with motivation and encouragement. Compare life coaching to your sporting coach, like your high school band director or football coach or cheer coach or, so on and so forth, your volleyball coach, so on and so forth. They are there to teach you skills and then hold you accountable at reinforcing those skills and then fine-tuning them when it's not working well for you. That's kind of how I view life coaching. And when I am practicing life coaching, even though I'm a licensed professional counselor, I am very clear on my boundaries that when I'm a life coach, I am in a psychoeducational role. I am withholding diagnoses. Life coaches should not be diagnosing you. If they are giving you a diagnosis, that is inappropriate. You need a licensed professional who has been trained in diagnostics in order to give you a diagnosis.
Right.
Okay.
It feels very much like, here's the goal. Let me as a life coach help you get there. Right. I'm gonna throw in some steps that usually work, and let's drive on. There was another thing that you mentioned, I think, as we were talking about. I forget who said it, but you said that like a book. You might read a book that has a lot of tools in there. I'm going to pause you.
Okay, I'm going to get to that. I'm going to get to that after I do the counselor. So hold that thought. We are going to get there. It's right here on my side margin.
I'm holding it. I won't even breathe until we get there.
Please breathe. I don't need you to pass out in the middle of the episode. So one of the things that John DeLynn was saying was, for life coaches about faith crises, one of the benefits of a life coach when you're going through a faith crisis is that most of the time those coaches have also experienced a faith crisis.
Right.
And that if I'm Mormon having a faith crisis and I seek a life coach who is also Mormon, there's a lot that goes on there. There's a lot of things that we don't have to say. I think the example they gave was, if you go to like Margie DeLynn for Faith Crisis Life Coaching, you don't have to spend an entire session and pay for an entire session explaining the temple rituals,
Right.
because they already understand. They've also experienced it. And so one of the nice things about life coaching is that not only can they give you some tips on and help you get through it and refine community and establish friendships outside of the church and connect you with resources, and it's a very specialized thing. They can do that, but they're also a mentor, kind of like the Big Sisters Big Brother program in the foster system. These individuals are not licensed and professionally trained individuals outside how to be mentors for kids. And there's a lot of supervision that goes into that, of course. Whereas life coaching, there's not often a lot of supervision, but keep that in mind, that a life coach can be a mentor, but that they're helping you create life skills, increased communication skills, very much how to, very much psychoeducational. This podcast is a life coaching, self-help podcast, in the sense that I'm not providing counseling on the podcast. I might be introducing people to skills and techniques and tools that they can use along the way.
All for that eventual goal. There's a strong mentorship program inside the Army. It's all about, how do I become a better Army soldier, better Army officer, whatever, because the focus is, you guys share the same focus. I've been where you are. Let me see if I can walk you through some of the steps, and maybe even help you avoid some of the mistakes I made, or whatever.
Right, absolutely. The last thing I want to touch on with life coaching is relationship life coaches. Now, we get into some really kind of gray area here, because relationships are hard. And unfortunately, counseling has this horrific statistic. Up until about 10 to 15 years ago, if you went to a marriage counselor, you were more likely to get divorced than stay married, which is a terrible statistic for counselors. And so it makes sense that a lot of people have turned to relationship coaches. The challenge with the relationship coach, or life coaches in general, is that they're able to offer kind of anecdotal advice, skills, and tools, but where they're limited is that they really should not be helping people work through unresolved traumatic events. Things like marital affairs and other betrayals, compulsive behaviors or addictions within a relationship. I mean, AA is a life coaching like program, but you still got to see your addictions counselor who helps you understand the underlying psychology that's leading to those behaviors. Sure. And so where your life coach is really limited is that if you are experiencing significant trauma or unhealed wounds from regrettable incidents in your life coaching is limited in what they offer. And where life coaches can often get in trouble is that they have such a great desire to help that they inadvertently offer advice that can be very harmful. And that was the warning that John Larson said was, if you're leaving the Mormon church, you're traumatized. I don't care what you say, but you are. And that's true. But just because you're traumatized does not mean you need a licensed professional counselor or a licensed clinical social worker or a PsyD or a PhD leveled clinical counselor. All of these licensed professionals, it doesn't necessarily mean that, but you need to recognize that if you've got a life coach that is helping you work through deeply traumatic things where your symptoms are beginning to interfere with your daily functioning, or you're not getting better, you really need to see a licensed professional. So I have a friend that does life coaching for nutrition and diet and exercise. She went through 4 months of training, and she has a very successful life coaching practice. She charges almost as much as I do, but she is very specific. She stays in her wheelhouse of diet, nutrition, and exercise.
Right.
I have, to get my master's degree, because I also did that psychopharm piece of my master's degree, I have my 4-year undergraduate degree. And then I have an additional 3 years of training for my master's degree. And I don't have any subspecialties in psychopharm. I actually took the psychopharm class so that I would be more well-versed in helping patients understand or clients understand medications to reinforce medication compliance. But I also did it because I've got our son Brig with schizophrenia. And I was like, I need to understand this better so that way I can advocate for him and do that. So I've got those extra courses, but I don't hold a certification in psychopharm. Master's level counselors can, I think, prescribe in like 5 states or something like that. And I'm not in any of those states. So, but I do have that education, which is very helpful to clients when a doctor prescribes them something and they're like, yeah, I'm not going to take that. I can sit down with the client and I can say, hey, well, this medicine is doing this. This is why. If you've got questions, you got to go back to the doctor. But I have to be very careful because if I start making recommendations for meds, I'm outside my scope of practice.
Right. Regardless of whether or not you know how to do it, the whole medical field is very highly regulated for safety reasons. And you could argue whether or not some of that is necessary, but regardless of whether it's necessary, it exists, and it's very important as medical professionals that you stay within that realm.
Right. Well, and I've had several psychiatrists tell me, as Brig's mom, you probably know more about medications for schizophrenia than I ever would. But that's because I've dealt with schizophrenia meds with
very personal
my
for you.
son. It's very personal for me. That does not mean I can go to somebody else with schizophrenia and say, well, you need to give them these meds.
Right. You also see schizophrenia on a different level than most psychiatrists will, because they're going to be in the office for a few minutes getting stories.
Right. I live it.
But they don't see it. Right. The same with you, like when you worked at the prison for a little while, you saw it in real life. It becomes more real to you when you see it that way.
Well, and in the prison system, when I worked, so it wasn't the prison, it was a jail. It was a county jail. But when I worked in the county jail environment, I was very blessed in that the supervising psychiatrist recognized that I had more experience with schizophrenia and therapeutic techniques and medications than he did. And so when we sat down to talk about meds, if I brought something up, it was more of this teamwork setting.
Yeah.
And that was beneficial for the client. But that's a clinician dependent thing. I've worked with doctors who are like, you're a master's level counselor. What do you know? And they don't take any of my suggestions. But this one doctor, when I said, hey, what I'm seeing is agitation, and I was able to use that more medically advanced terminology, our patients in the jail had much better treatment outcomes, which is our goal in the first place, is to make their life better.
I think that when it comes to life coaching, correct me if I'm wrong, but you're speaking the same language, right? So if you come to a life coach, for instance, a religious issue, you're speaking the same language. There's a lot of quality that can come out of that because the language that you speak is the same.
I'm not sure I'm following what you mean by language.
So, well, to go to Mormonism, faith crisis in Mormonism, if you go to somebody who's gone through a faith crisis in Mormonism, you understand the same things in general. When you say temple, they know what you mean.
So you're talking about like the assumption of similarity, meaning because you're a faith crisis person, for people coming out of Mormonism, I understand the environment on a deeply intimate level because I've experienced it. Yeah. Therefore, we have the same verbiage?
Yeah, a little bit. The same thing as when you're talking with a doctor, if you're using the technical terms, they immediately will trust what you're talking about more than if you come in layman terms. Whether or not that's appropriate doesn't matter. It happens because you're speaking their language.
Well, and one of the things is a good counselor, a good clinician, therapist, counselor that's licensed is going to be able to adapt their language to fit whatever client is on the couch. So and it's really interesting. John Larson had said something about general practicing clinicians. I wouldn't go to them. I would go to somebody, and I think it was John Larson. It may have been John Dehlin. I don't know. I get them mixed up. But they said, I wouldn't go to a general practicing counselor. And I would say, well, why not? I mean, I think all of us as counselors, we start out as general practitioners and then we specialize as we move forward. I would say that for me, my specialties where I've taken extra training and credentialing is in trauma, in marriage, in anxiety, and now in religion. So those would be my four, like where I've received official training in that. But because I live in such a small rural community, I'm still going to see those general things like anxiety and depression. And so really what it is, the longer, because I'm required to maintain so many continued education credits, the longer I practice, the more specializations I have, because I want to be able to stay at the top of my field and constantly use evidence-based treatments for my clients. And the longer you're around, the more you see. So just like, if you're going to a doctor with 20 years of experience, I expect that doctor to have more specialities.
Sure.
Then, so I would say as far as a general counselor versus a specialized counselor, it really interview your counselor, interview your life coach, see if they're a good fit. Ask them. Like, I think it was John Larson that said, interview them, like go in with some questions like, how are you going to help me?
Yeah.
I like that. When my clients come in and interview me in that way, I love it because it demonstrates for me their motivation for change, but it also right from the get-go makes it very clear what they expect out of the relationship.
Right.
But a lot of people just aren't equipped to come in and do that. I would say that, again, one of those things that's really, when you're talking about like relationship life coaches or faith crises life coaches, because they don't have that higher level of training, the risk for countertransference becomes very high. I spent tons of classes studying countertransference in the LGBTQIA population and racism and drugs and relationships and this and in that. And so when I'm practicing as a counselor, I have been trained to separate my triggers from the client's triggers and then to recognize, whoa, and I'm starting to do that transference thing. I know how to pull back, identify it and whatnot. And so I have a lot more training as a master's level counselor than most life coaches. Now, another thing I wanted to address that John Larson said was get a PhD leveled clinician over a master's leveled clinician. And so I just want to kind of clarify some training here. It is not uncommon for a doctorate level counselor to have never worked in the clinical field. You can go from a degree, an undergraduate degree in almost anything, and then jump into a PhD program for psychology. I believe that's what John DeLynn did, but I don't know for sure because I don't know him personally. And so when it comes down to that, there are a lot of doctorate level clinicians here in our local area who come to me, a master's leveled clinician, for advice and experience because I have more on the job training and my treatment outcomes are such, and my specialty training and my experience is higher than theirs as a doctorate level clinician. And so I respect that they have more school than me, but depending on what they specialized in their PhD is going to determine the amount of clinical experience that they have. So for example, Brene Brown is very good at identifying that her specialty in her PhD is research.
Right.
I don't know Brene Brown at all, but it wouldn't surprise me at all if I have a lot more clinical experience than Brene Brown. But I have very little experience in conducting research interviews and doing that qualitative stuff. And so you've got to be cautious with saying a PhD or a doctorate level counselor is going to be better than a master's level counselor. It really comes down to who has the most time practicing clinical counseling, because there's a lot of nurse practitioners who I would much rather go to than an MD because of their experience with patients.
Right.
And so I
It
wouldn't
depends
throw
on
out
what you're trying to find
Right.
in that practitioner. Absolutely.
Right.
Yeah.
So again, that comes back to interview your clinician. If you
Yep.
want a doctorate level counselor, ask them if their degree is in a clinical field or not. I can't remember the other one now. Clinical
Or
or
just-
research or
Right. Just
education.
how much time have you spent
Right.
actually counseling people? Because what I'm looking for is a counselor. And if
Right.
you haven't spent that much time counseling, then your doctorate degree may not mean very much to me personally as a
Right.
client. So not
Right.
to devalue anything that someone has done, master's, doctor. I mean, I'm medical as well, so I get all of that. But ultimately, it's about what is it that I'm needing,
Right.
and it might not be. I don't need a doctorate psychologist, right? I need a counselor who has some experience working people through trauma and traumatic situations. And
Right. Well, and a lot of
whatever.
your doctorate level psychologists, their focus is testing and evaluations to inform treatment for the psychiatrist and the master's level counselor. Like
Right.
all they do is conduct evaluations and psychological testing. And another one might be research, and another one might be education. I mean, I've got several colleagues that I went to my master's program with that have gone on to get their PhDs, and a whole bunch of them are in teaching psychology. But on a clinical level, they're a PhD from that education side, and I'm a master's level counselor, and we have the same experience in the clinic. They have more experience teaching that to a collegiate
Right.
classroom. So, I mean, yeah, you've got to interview your professional so that you understand their training, understand their speciality, then try them out for a couple of sessions, and then decide whether or not it's going to be a good fit for you.
This is about you.
Absolutely.
So yeah, find the person that's going to work best for you.
Right. All right. So the second question here is, okay, so what's the purpose of a counselor? And I would say that you want to seek a licensed clinical provider. So LCSW, LPC, clinical psychologist. Those are some of the most common ones. Those are
Right.
not all of them, but that clinical therapeutic relationship where they are licensed is when you are struggling with unresolved trauma or emotional wounds. Those underlying deep-seated wounds, you really need somebody who has the experience and the knowledge to help you connect how your past is influencing your current day functioning. You want somebody that's got some neuroscience understanding and training, who understands how that brain works. So if I'm looking for a counselor, I want somebody who is neuro-informed, neuro-trained. I'm actually thinking of going in and completing my PhD as a PsyD, so that would still be that clinical master's degree, because I love the clinical work. That's my wheelhouse, but with a subspecialty in neuroscience. And I haven't decided yet if I want to do clinical neuroscience or research neuroscience, but I love neuroscience. It makes me giddy. I love it. So when you're struggling from unresolved trauma, or your symptoms are impairing your ability to function in your environment, you need a licensed counselor.
I think those are, I love that this is I feel very easily understandable and identifiable criteria. My trauma or my emotional wounds are really starting to affect my daily life. That's something most of us can understand. So I love that. Easily identifiable criteria works for my simple brain.
So, and on that, Mason, we talk about our daily stuff like anxiety and depression. So situational anxiety and depression is appropriate, and you don't need a counselor for it.
Sure.
Unless it's moderate to severe and interfering with your functioning. Yesterday we had our Great Pyrenees Anatolian Shepherd mix. We had to put him down because we went to the vet thinking he just had eaten something that upset his stomach, and found out that he had a pleural effusion. He had fluid all around his heart. He was having a hard time breathing. His heart was working
Probably
too
had
hard.
cancer, yeah.
And there was a very large mass around his gallbladder that was most likely cancer. And so we were sad and depressed and we're still kind of struggling with it when we talk about it, that depression is situational. It will resolve. We go back to our daily functioning. You know, if you have to take a couple days off of work, totally fine. That's normal. That's appropriate. If we have to take several weeks off of work, maybe not.
Right.
Are you laughing? I dropped my pen and I have to have a pen in my hand. Like I cannot counsel or teach or function without shaking a pen at somebody. Give me a second. I'm going to pick it up. Ta-da! Got my pen back. Whoop, whoop. Okay, so yeah, if your anxiety or depression is chronic or moderate to severe, and really we measure its level of intensity based on how well you're able to function.
Right.
So I would say anything that is, if it's chronically mild, counselor.
Well, and if you're not sure, ask.
Yeah, if you're not
right?
sure.
Go see someone who, you know, the same thing. When you go to the doctor and you're like, this is what I've got going on. Is this something I should be worried about? You know, much of the time the doctor's going to say, yeah, probably not.
Right.
But if this starts to happen, then come back and see me. Or they might say, yeah, sounds like something you should be worried about. Let's run some tests or whatever. So you ask. You don't lose anything by asking.
Well, and a good life coach is going to recognize their limits and stop. I know that in my field, and I can't speak for every counselor, but I know in my training, we were trained how to recognize our limits and how to provide referrals that are helpful, that will get somebody to the right type of clinician. Like I've spent a lot of my career building networks with other colleagues and clinicians. So that way when it's, you know, when I'm not making progress or when treatment has stalled out, or if I'm like, whoa, I really don't get this, I've got somebody I consult with, or somebody I'll even send my clients to and say, hey, you know what? I've got a colleague, her name is Jackie. She is amazing. And I'm being serious. Jackie is amazing. I refer people to Jackie all the time because frankly, I feel like when it comes to teaching people how to feel and how to work through depression, Jackie's your girl. When it comes to that, Jackie does better than me. 100% hands down. And so if I am recognizing that I'm not able to provide that surface or that service or help you meet the goal in a way that is satisfactory to you and myself, in a way that is measurable, and that's something I am held to a standard, my treatment outcomes need to be measurable.
Well, then you as a good counselor have learned to recognize that in yourself. What we want today is for you as a listener
as
to
the
recognize that you need to watch that, because as we addressed at the beginning, not every counselor is aware of that. Some counselors will just keep working with you even though they're not getting anywhere, you're not getting what you need. So we want you to be more informed as a client so that when you go, you can be saying, what are you going to do? This is what I need, blah, 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 so that you get what you need from that relationship.
Well, and also understand it's normal for the occasional session to not feel like you made any growth.
Sure.
That's normal. That's okay. But if that's the consistent feeling you're getting as you leave the session, it's time for somebody different. It's time to get a referral to go to somebody different. But yeah, I, as a professional, have been trained to recognize my limits and also to refer to certain individuals in my community and outside of my community to help connect you with resources that can help you with that.
Awesome.
The other thing is when it comes to relationship counseling, I like to look for somebody who is trained either with Susan Johnson's ACT program, and especially somebody who is familiar and trained in the Gottman style, because when you combine those things, those together, you've kind of got that gold standard for relationship counseling. Now, the nice thing about the Gottmans is that they've extended their training and their certification to people other than licensed clinicians. So you can have a life coach that is Gottman trained. That I would say is appropriate because they've gone through those trainings to get the skills that are current day. Like that is the gold standard today for evidence-based treatment. With a counselor, If we're not providing evidence-based treatment, you can sue us. If we cross boundaries, we can lose our license. Like, it's regulated so that way public safety is protected. So if you come and you see me and you feel like I have stepped out of bounds, I have to provide you with the resource to contact the state that I am licensed in, and that state has the right to investigate and revoke my license. I mean, I can get sued, and because there are those high-level consequences hanging over my head that could destroy my career, I do a lot of work to make sure that I am practicing at a very high standard because I don't want to get sued. I mean, that is nobody
worked hard for your license, right?
Nobody wants to get sued, but I'm here to tell you, it's kind of hard to sue your life coach because there's nothing regulated there, and so there's some safety and whatnot. But again, shop around. With relationships, you really want to see a licensed clinician if there has been some betrayal trauma, or if there are some deep emotional wounds due to regrettable incidents. And when I say this, I'm talking about affairs, chronic fighting, addictions, either, one partner or the other's got some addictive patterns or behaviors. If there's personality disorders going on, so if you think your partner or you are struggling with narcissistic personality or borderline personality, histrionic personality, antisocial personality, let's just cover all the personalities.
Just shout them all out there.
Well, and let me just add, if you've got a personality disorder diagnosis and you're seeing a life coach, also see a licensed counselor. You can do both. But yeah, those personality disorders can get really, really complicated. You want to see a counselor who has specialty in personality disorders. I have a lot of experience with narcissism and borderline. I do not have a clinical specialty in treating personality disorders. That doesn't mean I can't do it. But what it means is that when I'm treating somebody with personality disorder, I am monitoring for measurable progress, because if I see that we've stalled out on measurable progress, I need to refer to somebody who has that speciality. So a general practitioner counselor is a good one, is going to know their limits. And when they recognize that they're not a good fit, they're going to refer you to somebody who specializes in that area. Just like a general practitioner doctor, if you've got an ear infection and they treat it and it comes back, and you treat it and it comes back and they treat it, you're gonna get a referral to an ENT.
Right.
Because that's beyond their scope. So don't poo-poo on general practitioners. Interview your practitioners. There have been some primary care doctors I've had that are awesome. There have been some general practicing counselors who are amazing. And some of them aren't. And that's normal in the field. And I could be the best counselor in the world and still not be a good fit for you because of the way I approach it. And that's okay. That doesn't mean that I'm a shit counselor. It means I'm not a good fit for you. In that 80% of the counseling has to do with the relationship. Mm-hmm. You got that other 20% of evidence-based treatment, therapeutic interventions, accountability, advocacy.
Right. But you're not going to get to those things if the relationship isn't a good fit. Whereas on the other side, doctors, right? If I go to my general surgeon, he needs to take out my gallbladder. The relationship really not all that important, right?
Right.
But you can't as a counselor get to maybe quote unquote the nitty gritty of what needs to happen for you to overcome what's going on if you're not comfortable sharing with me what's going on.
Right.
So yeah.
Other things that you want to see a counselor for is if you're struggling with compulsive behaviors, especially compulsive behaviors that are getting, again, in the way of your ability to function in your environment comfortably, or addictions. Now, again, with that addictions, I can say the AA program is a life coaching type program. It's a mentorship. They help you meet your goals. But almost all of them are also going to be recommended to see a counselor at least for a time so that you can work through the underlying issues that are leading to the maladaptive
Right.
behaviors that are getting in trouble. And there's lots of ways that we can do that.
And addictions people like AA recognize that that's the case. They recognize that this isn't about addiction as much as it is about whatever is going on in your life that is leading you to an unhealthy coping mechanism.
Yeah, absolutely.
And then, sorry, go ahead. You had something else.
I was going to ask you, do you feel like I've covered the
absolutely.
counselor stuff?
The only question I think that I have, bishops, pastors, how do they fall into this? Because I think a lot of people will come to a bishop expecting counseling,
right?
When that's probably not what they're going to get. And so again, how do we fit into our expectations? Mm-hmm. If I go to a bishop, I go to a pastor, a priest, whatever, what should I have as far as realistic expectations for that encounter?
Right. So I would say the way that Sarah Westbrook defines that is I would say that pastoral counselors are kind of like spiritual life coaches, and that there's usually a specific goal in mind, and then they utilize your belief system to help you meet that goal.
Right.
But they're generally very limited in the depth that they can do. And oftentimes I would say the biggest barrier to that type of a relationship is the tendency to spiritually bypass things, to kind of minimize the impact of what's going on underneath that your counselor is really going to be able to get into the science of, and we call it a soft science, but as we get more and more information and we've learned how to study behavioral and mental health differently, we're getting a lot more of that evidence-based treatment where we're consistently seeing interventions work in a positive way. So we tend to get these kind of, like especially in the LDS community, you got to pray more, you got to fast more, you've got to read your scriptures more. And we do that over and over and over, but we don't get better. And that's a spiritual bypass in that, it's in God's hands, everything will be fine. But if you go see a counselor instead, you might find that, hey, this is the unresolved trauma that you've got going on that's leading your brain to do this. Right. Let's address this trauma so that you can have a different outcome. And at the same time, read your scriptures and pray and do those things. If that's spiritually significant and works for you, do it. Most effective counselors are going to check in with you and say, is what you're doing working for you? Yes, in what way? Is it hurting you? Yes or no? And in what way? Does that need to adjust as we work on this? Like there's going to be some curiosity. If you've got a counselor that is telling you to leave your religious group and those types of things, that is unethical. One of these, the LDS Family Services still refers LDS clients to me, even though I've left the church. And even though I speak out loud about people leaving the church. And the reason they do that is I have a really good relationship with those local people here in my community. And they know that even though I've left the church, I'm not going to be advocating for anybody else to do that because it's not appropriate. There's ethical rules and boundaries. And so that's another thing with licensed professionals is that we practice under a code of ethics. And when we step outside of that code of ethics, there are legal consequences that can occur.
Right. It would seem like, and again, correct me if I'm wrong, but it would seem like from pastors and such that there's always going to be some underlying bias there in that it's almost like, and you said the spiritual bypassing, which we've mentioned a couple times, but haven't really delved into. But the idea being that, well, because you believe this, let's try this kind of a thing instead of kind of drilling down to what the underlying issue is or whatever.
And I'm going to say that's pastor, bishop, priest specific. Some of them absolutely will, and some of them won't. I mean, you're going to see the same. Some people are really good. Just like bishops, it's bishop relay. Sometimes you have a bishop that really gets it, and other times you get bishops that are completely clueless. I mean, that's normal on that. I would say that the limit with pastoral counseling is that there's limitations there, and a good pastor is going to identify, recognize, and know how to refer when needed. But yes, Mason, I would agree that there's a little bit of some cognitive bias that because I have a strong religious belief in this, this is the solution. But I also don't want to ignore the placebo effect. I mean,
Right.
if you believe that reading your scriptures is going to reduce your anxiety, guess what?
It will
Reading your
probably reduce
scriptures
your
is
anxiety.
probably going to reduce your
Right.
anxiety. If it's spiritually significant for you and helps, we want to encourage it. Now, as a counselor, if I see something that's within that spiritual thing and I'm like, I'm not so certain you think this is as helpful as you think it is, I might challenge that and push against it a little bit. But there's going to be a very high level of respect, or that is the most clinically appropriate way to do it, is for me to push. But if the client's not ready, I know when to back up. And that's
Right.
another thing with counselors. A good counselor is going to know when to put on the gas and when to put on
Right.
the brake and when to just
Right.
sit in neutral. Like
And
there's,
that's how you avoid some compounded trauma, right?
and
Where-
that comes with experience. Like
Sure.
that, I mean, I'm going to
Sure.
tell you right now, I was good at gunning the gas as a new clinician. It took me a while to learn how to ease off that gas and just slow down. But that's because my brain goes 1,000,000 miles a minute.
Right.
And most people's doesn't. And that doesn't
Right.
mean they're dumb. It just means they take longer to get there. I tend to drive, a little speedster when I problem solve. And, most people drive normal, regular cars.
Yeah.
That's my ADHD. The other thing I want to add is that I'm just throwing my pen all over the place. The other thing I want to add here is that my concern with Mormon bishops is that they do not receive training.
Yeah.
There is no professional or academic training.
I certainly didn't get any. We talked about this before, right?
Right.
Just that there isn't that. You're called, you're expected to be able to, whom the Lord, so this is a very common Mormon saying, right? Whom the Lord calls, the Lord qualifies.
Right.
But there's limits to that too, right? If I'm
You don't
as
know
a bishop,
what you don't know.
right? As a bishop, I'm a spiritual steward, but I'm not a counselor.
Right.
I don't suddenly gain that ability, particularly in areas like this in the U.S., where right down the street there is a counselor.
Right.
If I'm in the boondocks somewhere where trying to see a counselor is dang near impossible, then maybe the Lord does qualify somebody a little bit more. And I know we have differing opinions about that, which is fine. Which is fine.
Well, and I was going to say, if you live in the boondocks, but you can get to a place with internet, there are so many resources now
there are
for
now, absolutely.
digital telehealth.
Yeah, absolutely.
That, again, in most of the world, what's the word I'm looking for? Modern world. No, like not third world countries, but
First world.
well, sure, whatever. Anyway, if you've got an internet signal,
You usually can find some sort of
you
resource.
can find some type of licensed resource. I mean, I would say about 50% of my clients since COVID, we went telehealth and haven't come back. And that's
Yeah.
okay. It works well for a lot of people. And then I've got clients that are like, telehealth is total shit. I need to be in the room. So,
And for them, that might be true, right?
oh
The
yeah,
last
always
thing
respect it.
The last thing I wanted to say about the pastoral stuff is that, again, healthy expectations, right? If you understand what you're getting when you walk into that relationship, you're going to be more likely to get what you need or quickly recognize that you need to be somewhere else for what you need. That is not to, like many pastors, chaplains, bishops provide a great service to people.
Mm-hmm.
Just like life coaches, just like counselors, just like any other profession, but you have to understand what the limitations are in that situation. And
Right.
while I believe that God is involved in people, and especially if they have stewardship or influence over other people, I think that God helps out in those situations. But I don't think that He miraculously makes you a counselor when someone else is there with that talent. And we need to be seeing the person that will be most able to help that person in an
Right.
appropriate way.
Well, and I would say when you're struggling to find a good professional, word of mouth referrals are probably one of the best ways to go.
Sure. They're not without their issues,
Yeah.
but absolutely word of mouth is important.
Yeah, I would say most of my clients come to me because of word of mouth referrals.
Yeah.
Absolutely. I mean, I can do all the marketing in the world, and I don't do a whole lot of marketing because most of the time I am completely booked.
Right, you're full already.
So I don't need to do a lot of marketing right now. But when I was, and when I was a brand new clinician, the only person I marketed to was, hey, stake president.
Right.
I'm opening my clinic. The next thing I knew, I was booked with all these LDS referrals, which was great. Yeah. And now I would say I only have a couple of my clients as active LDS members. Most of my clients are not anymore. And I liked it both ways, but that just demonstrates the difference in my referral sources.
Yeah. Mostly we want you to understand. So as a listener, understand what do these different services provide for me and how can I utilize them to the best of my ability.
Yeah. So Mason, coming back to that question about, or that statement that you had about books, what about self-help books?
So my thought was, as we talked about this, because we've all familiar with self-help books, whether or not we've read them. The idea is that the self-help book is oftentimes going to tell you what things you need to talk about. But the book
itself... Hang on, slow down. Say more about that. Please. Just do it.
Wow, I got a please. All right, I need to relish this moment. So let me see if I can explain this in the way that I'm thinking it. Oftentimes the book will expose you to something you need to learn about. Mm-hmm. But it will not be able to really talk you through your personal concerns or issues about that topic. For instance, you could tell me as a spouse, recognizing that I am not emotionally available to you, which, hey,
which I have.
Personal story, right? Vulnerability here. You can come to me and say, hey, Mason, you are not being available emotionally to me. But you, even as a counselor, are not in the right place to fix that for me. Mm-hmm. So in a way, you've kind of been this book. And I could go out and read things like Permission to Feel or whatever. And for some people, that's going to be amazing for them. For some people, like I love the idea of that book, but I struggle to get through it just as a print piece. And so for me, I had to go see somebody that could actually talk me through and teach me how to feel, because that wasn't going to come from a printed page for me.
Right.
And so what I mean is, and I kind of made this comparison to life coaching and counseling, whether or not that's accurate, but the idea being that a life coach can kind of talk to you about what things need to be talked about. But a counselor is the one that's really going to be able to delve down into what needs to be talked about, whether that be trauma or... And I realize it's not a perfect analogy by any means.
No analogy is perfect.
By any means. But that kind of what helps me. Right. It resonates with me in that the life coach is going to expose you to some things. The counselor is really going to help you work through those things. A bishop might be able to expose you to some things that are going on in your life, or a priest. But a counselor is the one that's going to really help to work through that. Right. A counselor might be able to really help you work through some struggles. The psychiatrist is the one that's actually going to help you manage those things with medication. It's about finding...
We all have different roles.
It's about recognizing which roles fit where and how can I use them to help me be healthy. Because every one of those roles also has its limitations. If you go to a psychiatrist for counseling, you're probably going to be disappointed. If you go to a life coach for medication, you are going to be disappointed because that is not their role.
Unless they're selling something they shouldn't be selling.
Right.
So my thing with self-help books is I would look at a self-help book, even when those self-help books are written by very qualified clinical professionals.
Yes.
They are meant more as a coaching tool because they are they are psychoeducational. So Mason, like you said, it introduces me to topics. It might help me raise my awareness of where I have
generic.
something in my life that I might need. I wouldn't even say it's generic. Some of them are very specific, but
I'll
it's a way
explain what I mean by that in just a minute too.
It's a way to inform the masses, the population, so that they have a better idea of what to address when they go to a professional, where you would want a counselor. Like, I mean, I prescribe, let me just go backwards here a little bit. I, quote unquote, prescribe self-help books to my clients all the time, because they can go home and read a book in a couple of weeks and come back. And now that they've been introduced to an area in their life that needs work, we can then get down work.
To the business, yeah.
And they paid $24 for a book rather than $150 to $200 for a session with me. And they now have 6 weeks worth of information. So I will allow that tool to give them the education piece. But then when they come back to me, our work is taking that information, adapting it to the client's personal life experiences, trauma, issues, learning styles, so on and so forth. And then I'm there to help them take that, to the next level of healing. It's like the book provides the antibiotic. I help you swallow it.
Something like that. Yeah.
Something like that.
So
hang on. I've got one more thing I want to do, and then I will have you go back.
Generic thing. Did you want to move on?
Go ahead.
Okay.
You give your generic thing.
So what I mean by generic is that, like the book, The Body Keeps the Score, is going to cue you into the fact that your body is affected by trauma. It's affected by experiences that happen. But the counselor is going to be able to say, okay, what happened for you? What was your trauma? How has your body kept the score of this trauma, and how do we now work through that?
Right.
That's what I mean by generic, is just that the book is going to say, this is generally what happens, and it happens to everybody to some degree or another. But if you want to work through it, book's not going to help you work through it very much.
Right. I'm going to say The Body Keeps the Score is an amazing resource for understanding how emotional, mental, physical, whatever trauma, how that impacts functioning in all kinds of areas.
Right.
It's not as good at teaching you how to heal from it.
Because that's the part where somebody else has to get involved in understanding your exact trauma. Right.
But then I'm going to compare that to the book Burnout by Emily Nagoski, which very clearly gave us the how-to on completing the emotional cycle. And so that one really gave, I would say for most people who read that, they come in, like if I give the book Burnout as a reading assignment for my client, they come in and they're like, I understand this emotional cycle. Yeah. Now what? And I will have them read that book so they understand that cycle. Then I check in with them to make sure that all the educational pieces are there. And then we start doing the deep trauma work.
Now,
and when
how
they
does
get
this affect this?
Right. And then when they get stuck, I'm like, when they get stuck
with the T.
Right. When they get stuck, then I'm able to say, go back to burnout. What is that emotional cycle? And for me, I've created my own RAID acronym.
You've educated them in a very important general principle, and then you help them practice.
I see what you're saying now. That makes sense. Okay. Yeah. So then the last piece is I want to make sure that I give another example that counselors are also limited. So for example, my friend who is a life coach on helping people meet their nutritional needs, their exercise goals, food prep, all of that kind of thing. As a counselor, if I'm working from the counselor mindset, I'm not going to be doing that piece.
Right.
I'm going to be working with you on why you are emotionally eating, how your emotional eating is showing up in your life.
Right.
We're going to talk about the triggers and the deep emotional stuff so that you can get better control over those impulsive, compulsive, traumatic patterns of behavior or post-traumatic patterns of behavior. But my friend who is the life coach is going to be a great person to mentor you and help you develop meal plans and those types of things that would be outside of my scope of practice. So like if I had a caseworker here in my clinic, I would work with somebody on the emotional eating behaviors and maybe even the addictive behaviors of eating. And my caseworker is going to be the one that helps you build plans and goals. Now, some counselors will absolutely do that.
Sure.
But if you're limited on funds or you're bound by insurance rules, going to a life coach for that mentoring and advocacy is going to be very beneficial. If you come to me because you're in a faith crisis, I'm going to work with you on how that trauma is affecting you and your anxiety and your depression. And I'm going to help you learn how to challenge perspectives and shift things and address trauma at its source. And I might send you to a life coach so that way you have somebody there. So when shit hits the fan on a Thursday and you don't see me again until the following Thursday, like we meet Thursday morning, shit hits the fan Thursday evening, you can call me, that's fine. But if you've got a life coach there that's like, you know what, we see this a lot, people struggle with this and they normalize it, and you've got that mentorship and that coaching, that can be a very positive thing. So it's okay to have a coach and a counselor at the same time. That's normal. And really, my call to action is, instead of saying life coaching is better than counseling or counseling is better than coaching or, so on and so forth, I want you to recognize that every field has its benefits and its limits, and that if you can find a team of counseling professionals and coaching professionals and psychiatric professionals and all of these people to work with you, and we all know our roles and we all know our place and the part that we're doing for you to reach those goals, as we're working together as a team, you, the patient, you, the client, has the best potential for reaching an outcome. It is very common for me to spend 12 to 16 weeks with somebody working on the deep trauma stuff. And then I'll say, hey, you know what? Shadow work sounds like something that might really fit your learning style and give you some more insight. Here's some people that do some life coaching on shadow work. Go to them. If you have any questions, call me. And we'll take a month pause in our treatment so that they can go meet with this life coach, gain that perspective, and then come back, and then we'll apply what they've gained back into their counseling. And then it might be, okay, now I want you to, you're doing great, you're maintaining, go do this thing, and let's see how that does, and then come back. And so you really want people who help you identify and establish a network that is always working for your best interest.
Yeah, I'm reminded of something that we talking about last night. We were watching our kids at the football game, right? They're in the marching band, and you're talking about how it seems as if our experience is that every different organization in that is supporting each other. They're all, cheerleaders, flags.
Our kids' high
football.
school.
There were three or four kids out there with their football pants on and in the marching band, and the idea being that it doesn't have to be a competition, right? It's not about, well, is a counselor better? It's about, is a counselor better in this situation?
Right. What do I need now? And what I was talking about last night about the football team and watching was, I absolutely loved seeing how the band and the cheerleaders and the student section, how they were all working together.
Yes.
Because when I went to high school, the band, and I know this because I was in the band and in the cheerleading squad and the dance team, we were always in competition. Like if the band started playing while we were cheering, there was anger and like, rawr, and it could get pretty intense at times. Right. I loved watching the majority, and our kids, I love our high school. They do a really good job of making sure that each organization supports. And one of the things that's awesome is that like the wrestlers go to the basketball team dressed in their singlet to cheer for the basketball team. And then people from the basketball team go to the wrestling matches and cheer them on. Like, I love to see that community in our teenagers' school structure, because it's that type of networking and community that gives us the best outcome.
It was a better performance.
Right.
Right. When everybody was there working together and you could tell that they were working together, it was a better performance.
Yeah,
and that's why I wanted to bring that up. Is just that when everybody's together, psychiatrist, counselor, life coach, whoever, it's a better performance. You're going to end up a better person and in a healthier place because you have all of these different people in their own spaces working for you.
Right. You can tell you have a good medical team if you're inpatient in the hospital when the nurses and the doctors are communicating well and taking care of you. That's a positive experience. Yeah. And I've, unfortunately for us, we've had kiddos in the hospital multiple times, and I've seen it go both ways, and I've seen it in between. Yeah. So if you can find a team of professionals that are really there working together for you, that's awesome. Yeah. So I want to close with the idea of, we come back to your sister who had told me, I like life coaching. It works better for me. And again, I do not know her reasons for feeling that way. But one of the most common things that I see when people say that and they come to me and they're like, well, I'm not sure, I like coaching better, blah, blah, blah. What I generally am able to identify is that counseling is hard. So is life coaching, I'm sure.
Right.
But in counseling, the goal is to sit with and learn from really uncomfortable feelings and emotions. And so a lot of times the main reason people will avoid counseling is because that feels really icky to them. And that's okay. That's normal.
Right. Nothing wrong with that necessarily.
Right. What I want to make sure that our listeners understand is that if you're that person, life coaching is probably a great place for you to start in order to see progress in the areas that you are seeking that life coaching for. But recognize most of the time that is limited. Yeah. And that stepping into that uncomfortable emotional brain space with somebody you feel safe with is going to help you heal things at its root rather than cover things up. Now, I'm not here to say life coaches cover up things, especially not intentionally.
Sure, not at all.
But it does happen. And so if you have deep emotional wounds that you are needing to work with, I need you to understand that healing is painful. If you break your leg, it hurts while it heals. Yeah. I've broken my hand, and I can say that the initial injury hurt. The healing process was excruciating. With my shoulder, I was in a lot of pain. That healing process took me to my knees. But now my mobility in my shoulder is back.
Now you're better off.
Healing is supposed to be painful. It is supposed to be uncomfortable at times. And so if you're struggling to find a counselor and you feel like you need that, and it's like, I'm just not in a place, it's okay to start with a coach. But recognize there's limits. And that with a counselor, a qualified, effective counselor is going to help you work through your pain therapeutically so that you can achieve healing. And I would say from my own clinic, I generally start to see those turnarounds in 4 to 6 sessions. And I tell my clients, if you're not experiencing some significant growth, I'm not saying healing, but some significant growth and insight within 4 to 6 sessions with me, we need to reevaluate, because it either means I'm not doing my job or we've got some resistance going on here. And not that it's all your fault, client. That's a bad counselor. But to say, what's getting in the way? Is it the way I'm speaking? Is it the way you're hearing what's going on? Let's regroup and go a different way.
I think that evaluation is important in a lot of aspects in our lives.
Absolutely.
Yeah.
So Mason, did you have anything else you wanted to add for today's podcast?
I don't think so. I think that you addressed pretty much everything that would need to be understood in trying to make the decision about who to see and what to expect when you see them. And I think that's very helpful. I hope that the listeners find that helpful too, because most of us could probably benefit from some counseling. I know I have, and it's been short-lived a lot of times. Like I didn't go for 12 or 24 weeks or 5 years like one of your clients has, but it was very helpful for me. And I think the timeline is far less important than what kind of growth and change is going on in your life.
Consistent positive growth and change is the goal.
Yeah.
I don't like it when people put timelines because, I've got clients that come and see me for 4 to 6 weeks and they're golden, and I check in with them in a year, 2 years, and they're still doing great. And I've got other clients that we've been working together for a lot of years, and they are consistently making improvements. Usually those clients have some deep, significant, chronic childhood trauma
serious stuff
in
going
there.
on there.
Yeah, absolutely.
So I just want to say thank you, because a lot of Unpacking Mormonism, we take a lot of stuff and try and equate it to, religion and stuff. And we didn't do that as much today, because I think it's important for us to understand what resources are available and which ones will be best for us at which times and for what. And I feel like you did a great job of, I know I understand it better.
Thank you.
That's saying something. If my brain can get it, then most people ought to be able to.
Right. So in closing, I just want to give a shout out to John DeLynn, John Larson, and Kara Burrell for that episode, number 1660, which I believe, Mason, what was the title of that? Like, why
are ex-Mormons so angry?
Yeah, why are ex-Mormons so angry? Something similar to that. Yeah. I want to just express my deep, deep gratitude for that episode. It was beautifully done. You
love it when people are able to be vulnerable and real. And I feel like that's what was accomplished with that episode.
In the words of Brene Brown, loosely quoted Brene Brown, vulnerability has to be spoken and seen in order to get better. And I would say that episode, they really emulated that vulnerability. And I'm so grateful that they are setting a precedence that this can be talked about, because we need to hear it in our world. Mental health and vulnerability and all the feels have been taboo for so long. And thank you for doing that. And I'm really grateful that John DeLynn and John Larson had that discussion at the very beginning about what to do and when to see. And I just kind of wanted to chime into that as a licensed clinical professional who has focused the last decade of her life on clinical work, to say life coaches can be awesome and very beneficial. So use them. Counselors can be awesome and very beneficial. So use them. But how do you know
what to expect?
When and what? And what do you do if it's not working? Yeah. And the answer is, if it's not working, fire your clinician, and you can fire them by just not showing back up. Like, you don't have to make it a big scene. Just don't go back and shop around until you find a clinician that fits your needs, that you feel safe with. So thanks everybody so much. Can't wait to see you next time. If you've got any questions, feel free to email me at daisygirlcommunications@gmail.com. Thanks. Unpacking Mormonism is hosted by me, Sarah Westbrook, produced by Alex Vidalas. Our music today was by Lorenzo Emanuel, and I Hope You Know by John Worthy Music. Ta-da! Got my pen back. Whoop, whoop. Okay, so if your anxiety or depression